Oh, no. Okay, getting organized. Hello, Leo.
Hi, am I muted? No, okay. I never know if I'm muted or not till it's too late. Don, I haven't seen you in ages.
It's been a while. Right?
Yeah.
How are you?
You're with a hardcore group here. It's great you were able to get in. You look good.
No, well, I saw the notice and it just sounded perfect. I just really
Oh,
need
good.
to
Yeah, so I actually spent a little bit of time on this presentation, folks. And you'll actually, Don, you will remember some of this stuff because I'm starting way back and
Okay.
tying it to today. So it's going to be a trip. So great. I'm assuming Carrie's handling the waiting room. Carrie, are you there? Or should I? I'm sure you're there. You probably are on mute. I just hit admit all, but didn't. No, it's doing it. Okay. So I got nervous. I thought she pulled a webinar. I mean, we have another tool, and then I wouldn't see anybody, and I enjoy seeing people. So, all right. So I'm going to, though, when I'm sharing the PowerPoint, I probably have a tough time seeing folks anyway. Let me go ahead and share this. And I can't believe it is November. Oh man, folks, November. It's wild. Let me start the slideshow. So, got a good crowd today, and I hope everyone's staying safe and healthy. We'll do our normal COVID thing first, and then we'll shift from that to talking about policy milestones, part one. And yeah, there are going to be other parts over the next several months, is my hunch. And well, maybe not several months. It all depends. You know, as everyone knows, we changed the way we're doing the webinars. I am going to continue weekly as long as it appears people want to take advantage of them. Hi, Anna. And then, if we keep that up, the policy part might go quicker. You never know. So we'll see. We'll see what happens timing wise. So without any further ado, let me get the program going here. Welcome. It's November 2nd. It is unbelievable that it's November. All of us are in a bit of a deja vu. Hopefully not too much of a funk. We're going to get through this together. We really are. So let's hang in there together. So here's what's happening. Changed the governor's picture's not on it this week. Gave him a break from the picture, but the virus numbers increased further. It's 7,814 more people got the virus this week versus 5,000 and change last week when we did our last checkup. It's actually more than 2,000. And then the total number of cases, this is hard to really digest. It's 151, almost 152,000 in our state. Deaths rose up by one, in the sense 138 altogether, but one additional rise from the week before. And what's scary is as these numbers go up, the deaths could go back to where they were months ago. And in the USA, as of October 30th, 9.2 million cases, and right at the midline between 230,000 and 231,000 deaths, which is hard to fathom. I have a link there. By the way, for those of you wanting to see the data for the command center, you just hit EOHHS, Mass Command Center. We get updates by email, and I use those Friday to Friday. And then the other link, though, I put up is with the CDC. They actually have a forecasting page that if you're interested in looking at how they're forecasting. I do have a different map for you this week, however, and I'll tell you about that in a minute. Congregate homes, we're at 46. We went up 12 instead of 20 As you might recall, we went from 19 to 34 in just 1 week. And our friends at Disability Law Center were equally concerned and reached out, and we talked over sort of, trying to help move things along. So by coincidence, we have a steering committee on policy and advocacy here at the ARC that the board has delegated, some of the major policy decisions to, in addition to the Government Affairs Committee, which obviously will feed motions up to the board and the steering committee. But the steering committee subcommittee is going to meet with DDS on quality. And Jana Rico's the chair of that. Carrie Mahoney will be the staff to that. So I think there's like 5 or 6 members on the subcommittee. And coincidentally, this, we had hoped to meet earlier, and we're glad we are having that meeting soon about monitoring as the virus surges. At Rentham, there's actually 8 people out of 213 cases. In the first surge, the state operated programs had a 14% virus rate positive, while the community private programs at 16%, not a real significant difference given, the range of resources. But the rates at the large facilities, just to remind you folks, was 47% and 25%. And I don't know if Rentham got off to a quicker start this time because they had a lower percentage of positive viruses. But it just shows you, there was that New York community program that had a ton of people in it, run by an agency that had 50, I think everyone had the virus in Long Island. So, anytime you have a larger setting, you really, it complicates things. And I have the link here when you get it, the link on PDF, you'll be able to look directly at those stats. They come out every Wednesday. So this is the sort of wild chart that I found on the CDC site. I was trying to get the New York Times chart again, and I realized, let me show you something different. But, as you can see, it's even higher than the one I showed you last week, the way the curve is going up. So it's unbelievable. It's happening. On the other hand, I think we're better prepared to deal with it this time around. And the only fear we have, besides people getting it and having other conditions and being at risk, is the fear of the hospitals, right? If they get overcrowded, we're nervous about that. So, there's a lot that we have to worry about. We really need to, stay on top of it and, be vigilant in our advocacy as people experience this. So we can obviously at the end, if people want to focus on questions in this area, great. If not, that's fine too. So, but I just want to make sure I did my normal update to you all. And, basically you get to see the daily rate. There's another chart, believe it or not, I'd gotten, and it actually moved online. It was one of those floating charts. And I said that'd be too confusing. So our priorities continue. We just updated our advocacy slide. In a few days after the election, we will be pushing for the phone to action alerts. And I think that's probably the best way to do it. The election's sort of capturing everyone's brain right now. So I think it's not realistic for us to think that people are gonna, advocate as strongly while we have this hanging over our heads. I just can't say enough though about our voices, our subjective voices, our personal voices, our stories are going to be important, because I think folks in government are just struggling with what to do, how to find the dollars. And if we don't speak up, there's a history of reasons we need to speak up. And coincidentally, we'll be talking about some of those in a few minutes. But equity in healthcare, equitable assistance for individuals and families at home, preserving the day and residential safety net, addressing special education, getting local outlets for PPE, and prioritize constituents for the vaccine. And nationally, hopefully we'll have stimulus after the election. And I'm not going to get into the election stuff, dear God, if that we could eat up 4 or 5 of these live shows, right? Having conversation. So what are the 4 policy milestones I picked for this week? And you are going to be surprised. I'm sure some of you are going to be very surprised. The first one is about healthcare is the theme. And remember, I'm not just going to talk about it historically. The few minutes I give to each one, I'm going to tie into the present day and the relevance to the present day. So you got PKU or phenylketonuria, which I used to be able to say some years ago. And I want to tie that to the theme of prevention, can also tie it to the theme of healthcare. And for those of you that don't know about this, that's okay. Some of you on this call were not born, possibly, when that was an issue. It still is an issue, but when it was, a serious cause of intellectual disability, educable or trainable. And if you don't know what that means, congratulations. It does, though, relate to present day and stigma and, the issues that people with disabilities face. And I'm thinking maybe I'll see how the slides play out. I'm embarrassed to tell you, I can't now. On my list here, I have it at the end. Community mental health centers, and that act in 1963, that was a foundational act from JFK, or you may know him as President John F. Kennedy, whose term was cut short by an assassination. And then the development of what was, no, I haven't misspelled it. It was the Executive Office of Human Services, EOHS, and really, I'm talking about the predecessor office to it. I'm not probably talking about EOHS per se, but I did my setup at home, so I couldn't grab some of the books we have here about the plan. Somewhere there's a booklet on that plan that Gunnar Dubois told me to keep forever. So let's start with this one, this milestone. Now imagine, why would we pick out one condition? Why is Leo doing this? Because it was a major issue in the 60s, late 50s, 60s, when it was discovered that a defect in the gene helps create an enzyme, was prevented from creating that enzyme to break down certain foods. And I could get into the name of the, specific thing and mispronounce it, which is phenylalanine. But the bottom line is, before there was, non-sugar sweetener, which aspartame is one of those things that has that ingredient, kids were getting PKU, and it was the whole issue of digestion. And I remember Alan Crocker, the famous MD who did such a huge role historically in our field, telling me something about there used to be baby, supplement that was used as part of the intervention, as well as avoiding certain foods. So, so that was a big deal. And the exciting thing about this was we found something that could really prevent intellectual disability from happening. The symptoms included neurological problems, seizures, hyperactivity, skin rash, an abnormally small head. Now, this young man you see, actually child, right, youth, that you see here, his head seems actually pretty, proportionally appropriate. But this was a cause. And the Arc of Massachusetts, by coincidence, and I don't know how much nationally this was, we actually worked with government. So in the days before confidentiality and HIPAA and privacy, we actually had, when we built this building, we're tearing down the old building, we found names because what people wanted to do was to reach out to the people that potentially were prone to having children with PKU. At that time, we didn't know as much about PKU, obviously. So let's think about that, as a policy issue, not only for the ARC, but for other organizations. Imagine in the 60s, how does it relate to today? And I think one way it relates is all around equity in healthcare, right? This was something that by taking it on, we could say, hey, look, people, it was good and bad in a way, and we'll get to that. That's number two. The good was we were able to say, hey, look, you can prevent intellectual disability to a great extent by making sure we tackle this condition, know about it early on. And you could argue it was a precursor to, put the idea of early intervention, right, in people's heads. Obviously, early intervention didn't happen until much later, though we had community clinical nurseries in the 70s. But that was one issue. The second was prevention and treatment. But actually, there used to be debates in our field, prevention or treatment. And that was something, I don't know, I'm going to pick on Don for a second, Don Friedman, who's great to see him on the call, who worked on so many things in the early years, and not even early years, for decades. Don, do you remember that debate over prevention or treatment?
Yeah.
And do you remember what was the people actually were opposed to prevention because they felt like it helped reinforce the stigma. Yes. And it
Right. Well, it fed into a lot of things. I mean, it got involved in the abortion debate, even then. But it had something. It was prevention was that that the disability was a problem that needed to be avoided.
Right. So it caused a little bit of debate. I'll never forget. I had a meeting with the Connecticut exec in the Rhode Island, and somehow that came up. She was doing prevention work, and I really didn't even appreciate that it was a debate. This would have been like in 1993 still, that there was a debate around this. So this is the first one I want to put out there, and we can talk about them, folks, if you have questions or you think this is boring and you want to complain, whatever. But it's what we're trying to do is, or the goal of this is really to show, you see the connection though too, right? It's not just about PKU, it's about how we have to be unrelenting around healthcare, how we have to be unrelenting about stigma and discrimination. So it is next, educable versus trainable. So this is, I had an article, again, I didn't do this here, or I would have been able to put a picture from one of our advocate issues from God knows when, that actually had two different articles. One on, and this is from Ontario, the Ministry of Children, and they're telling me my internet connection's unstable. Can you hear me okay? Okay. Ministry of Children, Community and Social Services. Right now, this is up on their website, and it's up a lot of places, I'm sure. And there was actually debate. I don't, ironically, I don't remember the custodial, though I remember the term. The real argument was, should kids who are quote unquote trainable with their intellectual disability, but not educable, okay, should they have a right to education, special education of any kind? And remember, the special education law per se didn't happen until the 70s, 72, 74, 75, in that era, because our law preceded the federal PL 19142, something like that. That became the IDEA, Individuals with Disabilities Education Act. So there was actually an intense debate over this. People, again, it was a way of stigmatizing people. Instead of talking about supports that people needed, instead of talking about the person first, right? People would say, oh, he's trainable, or he's, you know what, we've got to get some custodial help for him. He's not going to go anywhere, And it really was a way of avoiding opportunities for people, not taking that extra effort. And this is, of course, old language you're seeing up there: mentally retarded, mentally handicapped. It's good to know that was out there. As we had shared some weeks ago, I think the other words that were out there earlier. So, the field debated. And so in this context, when you think about sheltered workshops that today reflect a lack of progress, they reflected progress because people who had been devalued significantly were able to provide value and help and be part of the community by getting to work, even if those segregated, But devaluing persons with disabilities continued. Yeah, right. It's still around today due to bias or utilitarianism. And I went up and I looked up an interview with Peter Singer. You may or may not have heard of him. He's a PhD professor in philosophy in, I think, another area at Princeton, and now he's also part-time in Melbourne, Australia. And he's actually, based on his philosophy, not just he wouldn't agree that he's biased. He actually would say that some pets have more value than certain people with disabilities. This is like a person at a major university, okay? So there's a point at which certain values, you have to decide, what values you live with. And the fact that it's not just about bias, that there's actually people that would put some rationale behind this, that humanity can be divided into groups. And we know we do that all the time, right? But the fact that there's actually a philosophy, a university person and others who would argue that is scary, because then it gets to all kinds of things in our society that people could be prevented from. And then the other piece of this was, until the 1990s, most, if not all, states spent more on adults in institutions than in the community. So there was more, you basically needed services. You couldn't get them in the community. You were going to be reinforced to get them in an institution. I'm not even talking about, right? I'm not even talking about the medical doctor that says, drop your kid off and forget you had him. You'll be better off. That's actually something Peter Singer would say today, by the way, depending on, he said himself, and I'm not going to talk about him further. I just want to emphasize that these issues tie into other issues today, and the lack of equity in transportation, healthcare, education, and employment continues. So I just wanted to play that out for you. Okay, now some good news, huh? Hold on a second. I was just saying I don't have my phone. I'm going to grab it so I don't go over time on you guys. This is like a pretty exciting piece. For me, I love the picture. Sorry for the old name. He said, we must promote to the best of our ability and by all possible and appropriate means the mental and physical health of all our citizens. JFK, February 5th, 63. Imagine a president. You have to appreciate this was a big deal at the time. The president of the United States carrying this forward. And then in October 63, a month before his death, or a little more than a month, he signed the Maternal, Child Health, and Mental Retardation Planning Amendment to the Social Security Act. And that set off, for the first time, planning at the federal level, and it delegated to the states planning responsibilities, which is the related policy topic we're going to talk about today. So there was a systemic strategy, right, developed. There wasn't just, okay, let's throw a few bucks this way, or let's do a picture campaign, or, government was saying, we have a role in this. And this was before Medicaid, mind you, was even paying for care. Like states did their own institutions, right? They paid for them themselves. There was no federal reimbursement. There was no national strategy. And as we can talk about that in the future as one of the policy points, what the situation was like at the institutions, and it wasn't much better in the community. So this isn't about, pitting one group against another. It's really about the status of the situation. I'm going to show you. What I'm going to do is stop sharing here for a second. Well, no, I'm going to do that later. Actually, I'm going to wait. I have something from one of our history books to show you too, related to these themes. So the importance of the JFK 63 bill, planning effort must be backed by federal funds. States were to develop plans based on communities for mental health and intellectual disability. It was really a legacy from JFK. And this 1963 bill led to other federal efforts, including ESEA, which is the Elementary and Secondary Education Act, which did include some attention towards special education. Nothing like, believe me, idea that was instituted in the 70s by LBJ, Lyndon Baines Johnson, and the Developmental Disabilities Act that was forwarded during the administration of Richard Nixon. And that's a whole story in itself, which we'll do one day, is intellectual disability versus and developmental disabilities, and talk about that. It's a big policy point that sometimes confuses people. And then during the 1970s, education bills and Medicaid optional services would radically change our future. But you can see the rhythm of history, right? You can see like the reality of it took a first step. And let me backtrack to the 50s for a minute. Do you know the most popular policy step during the late 50s? One of them was summer camps. Okay, and we can talk about why that was later, but but obviously all kids need something in the summer. And that wasn't all summer, but it was just having an opportunity for kids with disabilities too. And family support was a big thing, but it was really bartering, people trading, helping each other through respite care, things like that. So this is a big deal, for public funds to be playing out this way. And then that brings us to item 4, and there's Governor John Volpe, who exited the stage as Secretary of Transportation in the administration of Richard Nixon. If some of you might remember, there's the Volpe Transportation Center in Kendall Square in Cambridge, which is was a big deal in an area of Cambridge that was not developed historically. So he gave back in a few ways, right? So this federal bill did spur efforts. And there was a gentleman by the name of Hal Damone, who's now passed away, who actually worked in Massachusetts in terms of planning projects. There was 2 of them. And one of these established community programs that still also heavily still supported the state schools. Let's not, get confused here. It's not like radically ideas changed or radically, oh no, we're not going to have any institutions. No, institutions were very much a part of reality here, and would be, for 2 decades to come. But it was an exciting time. Governor Volpe, Republican, followed by Frank Sargent, a Republican, very much, I would say Sargent more than Volpe even, championed. And then the New England Journal of Medicine said, quote, unquote, one of its articles, Department of Mental Health shall establish a comprehensive program of community mental health and retardation services, which shall include state hospitals, state schools, clinics, comprehensive centers. And, I'm sure there was stuff about community boards. Where this gets tricky is, it wasn't realized fully, okay, as you can imagine, right? As happens in policy development. But some of the things, spring out of it, like the community boards, community clinical nurseries, transportations for adults provided through school system, those were realized further in the 70s, okay? And I can't say for sure, was the Executive Office of Human Services established right then, or was it later on in the 60s, as opposed to 1966? I will know that in a few weeks, but I can't tell you for sure right now because I didn't have that book at home with me. And again, the Governor Sargent and Dukakis continued to build a community system while funding facilities. In fact, though Governor Dukakis was probably the first as a Democrat to close a facility, it was very hard to do, not only because of the parents that had fought, which again, we'll talk at another time, to improve them, but also because of the labor union element of this, and public policy is also about jobs. So let me show you the other thing. Hold on, I'm gonna share another thing before we have a dialogue, and I'm gonna shoot myself if I can't. Is this it? Nope, that's not it. That's a picture. I'm just going to try to, I guess I got to find it in my computer first, and then I can show you guys. I know I had it. Oh, great. Okay. Hang in there. I'm going to find it. I'm going to grab. So I have a thing from our history book that I'm dying to show you. And if I can't get it open in a minute, I'm going to let it go. I had it open for overnight. So, okay. Bear with me.
Hello,
Yeah.
Leo.
Hi, Jared. How you doing?
Can you also send me the percent thing?
Sure.
Send to me my personal email.
Sure.
Thank you.
Okay, so I'm going to share with you the screen. Sorry for that delay. And then we're going to have a conversation too while we're doing this. I know the chat, Carrie, if you want to help me with the chat, that would be great. I'm going to share this page, which now is up again. Wow, that's bizarre. I just opened it up. And here it is, history book. Okay. I'm just going to take it in 1960, opposed to the 50s. So there's another picture of John Kennedy. That was the signing day. The other picture I showed you was this was in October. And basically, it gives you a feel of the element. There's Eunice Shriver. Behind Eunice Shriver, two people.
Hello, Leo.
Jared, hold on a second, please. Behind a couple of people, behind her is the president of the ARC there, and who you can't see is the president of the ARC of Massachusetts is sitting back there for a minute. But the bottom line is 63 for PKU, 66, Governor Volpe, very big deal. So I just want to show you the history book and some of the pictures with that. And Charlotte Lodgem is pictured here where you see the arrow. She actually took Jessie Sargent, the wife of Frank Sargent, the governor, to Scandinavia to show them how services were. And there he is, Governor Sargent right there, up there. So just I can stop that screen sharing now.
So, yeah, Leo, there's a few things in the chat box. I'm just
Sure.
wondering if, Diane and Lucy, if you want to unmute yourselves, because it's kind of sharing
Hello.
their history,
Hello,
with
Carrie.
yours.
Hi, Jared. Kerry's asking some people who know some of those days, along with Don, who's with us today. Kerry, you might not know. So Lucy, do you want to touch base
Yeah.
on some of the
Yeah.
old memories?
Well, I'll go.
Yeah, so Jared, I'm going to mute you.
Go ahead, Lucy, because I know this would have been the whole trainable, educable thing would be a big deal, right? Because, you would be concerned that people with more profound impairments would be ignored, right?
Well, I'll jump in. This is Diane, and I do remember that Anna was slotted into the trainable track, which was probably Paul. Yeah, with Dad. Yeah, it probably was inaccurate at the time. It certainly limited all of the resources available to her and her outcomes. And I know that my mother, and I didn't really know this at the time, but she basically spent decades fighting for the right to education and was responsible for getting the first program in the United States launched for these individuals to be able to attend high school. And I remember her phrasing, and get them out of the basement.
Right.
So, this was very much the fabric of our lives, and it still is.
But your mother was a great advocate. She also encouraged people to put names on the waiting list for years and would always say that. So
On every list, she would
Yes.
say, get on every list.
you
Doesn't
don't
matter
have
what
to take it. You don't have to take it, but just at least have a shot.
Yeah.
Lucy, do you have?
Yes, I'm sorry it took me so long to unmute. I guess my son was born in 1963, and he has profound intellectual disabilities. And although there were other people currently going to school in Newton, there was never a program for him until the legislation passed. 94-142 was the beginning of it. And then finally, the Newton Mental Health Center was finally willing to work with me to push to open up a preschool for people with profound disabilities. And he ended up going to school all through his whole school career till 22 with almost the same group of people who lived in Newton. And it also then, as time went on, the movement to the community and deinstitutionalization, I was able to work with a group of people here in Newton to establish probably maybe either the first or second community residence in the state to take people out of the institution. And at that point, we had to take, I think it was 6 from the institution and 2 from the community were allowed to come into the community residence. And that ended up right now being a DDS provider that I'm no longer associated with, that currently still is providing services to many, many people.
We used to talk about the 80-20 rule, and I don't think it was 10 people, though. I think it's, as you say, it's 6 and 2. And also, though, Lucy, can I ask you that question about your son? Are you saying, so in the South Shore, we had these mixed classes for the younger kids that were, able to at least go somewhere? They were hosted in Weymouth, and it's called Mrs. Lincoln's class in the 50s. And otherwise, they wouldn't have a classroom as young kids. Are you saying he missed out on school until the 70s, that he didn't have an access?
No, he went to preschool when he was probably 4 or 5, so that would be the late 60s.
Okay.
And then also had to work very hard to get Newton to start a class, a public school class for him, which he then ended up, and it was a group of students who all were in the same kind of disability category, quite low functioning, who did go to school all together for till they were 22.
Right.
And even some of them are served in the same community residences. So there was a need, but it just didn't happen until all that legislation passed.
So Anna and Matt, really were faced with, or Maddie, I know you like to call them, were faced with, having the families really be leading the way. And as Diane said, and it was unrelenting, right? You couldn't let up. So I should have tied in the school thing even more, right? Untrainable. I can't believe I didn't tie it in. You guys did it. So that's why we have this dialogue.
But you see, these people were even lower than trainable. They might have been called trainable, but they were really functioning at an even lower level than
Yes,
I
but
would consider
we
saying they
were
were
ignorant as to what they could learn, individuals, right? Because we focused on what they couldn't. I mean, by the way, me too. I think when I started in this work, I'd noticed what a person couldn't do before I noticed what they could do. And I think that's a societal issue, Lucy, right? And then we're affected by the people around us, right? The whole acceptance issue, then our neighbors, our cousins, how does, and we've been trying to talk about that, right? The importance of extended family, our family being accepting. But in those days, right, you had to be pretty lucky to have that kind of acceptance, right? So,
yes.
yeah.
People were still hiding the fact that they had children with disabilities. They were afraid to let the world know. So yeah, it was very different than it is now. I mean, now it's very public. If you have a person with disabilities in your family, the world knows it. I once had an experience where most of the other families for my other children who were going to a local elementary school had no idea that I had a child with profound disabilities living at home. And there was a huge snowstorm at one point. It was the blizzard of 70 something or other. And you weren't
78.
allowed to drive to school. But I drove to school and I got such criticism, but I had no other way to do it because I had to take my son with disabilities. I couldn't take him in the snow because he couldn't walk. He needed to be, pushed in a wheelchair, and it was too cold and snowy to do that. So I had to drive my children to school, and I was criticized. And it was sort of like I wasn't keeping it a secret, but it just wasn't recognized because he didn't go to school with the other children.
And you're an outspoken person, and Diane and Anna's mother is an outspoken person, and yet people, wouldn't know, right? So it's not, there's a lot of pressure put on families. There's a lot of pressure that's almost like unconsciously done, right? It's not even, it's insidious. It's not even people doing it on purpose. They don't even know when they're doing it. And they don't ask, even if they might know, they might not have asked you, Lucy, or Diane asked your family. Even if they knew or noticed someone, quote unquote, different, they might not have had that discussion, right? And I'm wondering, Giassi, as a young man who's, very literate and educated, when you hear this, are you, what do you think as you hear some of this? I'll put you on the spot I don't know if you're double tasking or if you're totally engaged. Don't worry about it. If you're not, you can pass. But any reaction from you or Alice Taylor as well, or anyone else on this that you're hearing this?
I would add something else.
Go
Sorry
ahead.
to interrupt, but I just would make note of the fact that while we think that these attitudes and recognition may have changed over the years, they are prevalent in immigrant communities today. And we have many of these communities, close by. And these folks are sometimes, children are just sometimes hidden still. Some things just haven't changed. So I think it's important that we acknowledge that there's a whole demographic that we're sort of missing.
Good point. Thank you, Diane. Giassi, do you want to weigh in?
You were asking if I'm surprised. I guess I am a little surprised. I mean, I guess some of this history I have heard before, and I guess in the LEND program, I learned that there's a lot of progress that's been made over the years that I'm very happy about. That, I mean, it's that I have a legacy to build on. And,
Yes.
Yeah.
It is a journey, right? That's such the right word. you know, it's not, and that's why it's important to look back and then look ahead. And we're in a time where we could go backwards. I don't think we're going to allow it. We might have to take some things on the chin financially, but we can't allow it to go backwards. It's about 12. We got a few minutes left. Don, you want to add anything from your
Just
perspective?
on the educable, trainable thing, just one more note on that I think is, I think back, just the historical point, even to get to there, we're sort of skipping over. We're talking about that as if it's the ancient past. Things were terrible and they're better now. I practiced taught in special ed in 67, 68 in Lexington, very advanced school system. Practice taught in a class of educable, mentally retarded children, as the terminology was then. It was seen as a bold forward step. I mean, it built on a situation where these kids were excluded altogether from public schools. They went to Fernald, to the school at Fernald, or they just stayed at home. It wasn't all that long before then.
Right.
So at the time, it was a sort of an opening wedge of involving special needs kids in regular schools, if not in regular classes. And it really was viewed at the time as a progressive, positive step, and it was. I mean, so many of the things we've seen historically have been that way at the time. When the institute, when Fernald was built,
Right.
you know, it was considered to be the latest word in advanced technology and approaches to providing people with an alternative way.
And then they built these small homes at Fernald to replace the big buildings.
Yeah, no, everything.
I wasn't in Massachusetts when they built them, but I heard that was actually coached by Gunnar Dubois and other experts as a improvement. Anybody else want to jump in, Alice, or anybody else before we call it a session?
Well, I would just say that, you know, in addition to the progress, I'd like to recognize the backward look that the students at Gann Academy did a couple of years ago, documenting kind of the history of disability in the United States, and particularly in the greater Boston area. Unfortunately, with the pandemic, I don't even know where that exhibit is now. Nobody can get into a museum, even if there was a place that we could go see it. But that really opened my eyes to what had gone on. You know, I have my own little slice of experience with my son, who's, I guess he would be an older millennial. He's now 34. So we were in that kind of fortunate sweet spot where, you know, the city of Newton had not yet, I don't know, they weren't exactly woke at the time, let's put it that way. So they didn't actually give us a lot of pushback when we said, it was actually one of his own teachers in the Newton Brookline Preschool Collaborative came to us and said, this is not right for him. You need to go outside and I will help you. And I'm thankful till the day I die for her advice and wisdom and guidance. And that got us into a wholly separate private school where he was from age 3 years, 3 months to age 22. Were there some disadvantages to being separated? Yes, but I feel like he got the right education for him, and he's doing well now, and you can see him up at Market Basket 3 days a week.
I'll let this swing by. Yeah, I mean, that's the thing. That's another debate, right? Like, do you have 5 years to wait while the school system gets better at teaching your son or daughter? Do you have, sacrifice inclusion for education, right? That is a theme for decades.
And those early years, we didn't feel like we could sacrifice those
totally.
early years. We had to do something.
One. Yeah, no, I mean, and that's the challenge. And that's what we're experiencing COVID right now in a very condensed form. Does my son or daughter, does my brother or sister go to the day program or not? Am I risking too much? Or the business employment when they're employed? And so it's, hey, listen, this is great. We're going a month from now, every first Monday is going to be policy focused. So next week, we're going to have Fred Mislow on, who just stepped down as President of the Arc of the United States. So we're going to talk a little bit about national stuff and his experience. The week after that, Kerry Mahoney will do the resource show with me and talk about resources and those kinds of issues. The week after that, Jay Lynch is going to join us, or the week after. We're not sure which. Depends on if he wants his own theme. It'll be the 5th week because November has 5 weeks, but 4th week is federal and state stuff. So that'll normally be how we do it. And then usually the 2nd week will be about inclusion and self-determination and issues like that. So Fred will, I'm sure, touch on some of that. So thanks, everybody. Have a great.
Can I just say one thing,
Yeah,
Leo?
sure.
before
You can
go
always
off?
say one thing. Yes.
I'll try to do it quickly. Alice talked about a wonderful experience through the school system for her son.
Yeah.
But I think if people really are looking at what the school systems are doing now, that teacher would never dare right now suggest that a child go to private school. The services are so inappropriate for kids. Kids have to now fit into what's available. They're not doing individualized planning. And so then the kids, and particularly under COVID, we can forget that whole period, but just talking about what the schools are doing now is so inappropriate for most kids.
Thank you, Lucy. And Lucy, you've been on many things, but you have been a special ed advocate for, I don't know, a few years at least, right?
Yeah,
50
many,
years or
many
more.
years. Yeah, but
So,
not anymore. I can't take it anymore.
Thank you for sharing that. And hey, God bless everybody. Stay safe and healthy. Hopefully you can join us this week. I think we got the election day thing vote. Is that tomorrow, Kerry? With Maura and Ellen? Okay, I'm getting a yes. And then we have a couple of webinars coming up this month as well as Kerry coordinates.
No,
And Jarrett, you're going to get the handout, I promise.
no, I cannot register Tuesday thing.
Okay, all right. Well, we'll miss you there.
Terry, are you happening Tuesday? No, Tuesday webinar?
No, Jared, the Tuesday webinars are going to be, they're all gone. So if you get notes from the ARC, that's the best way to find out what's on next. There was just an email put out yesterday too about the whole lineup for the month. And this week we're also announcing our campaign for National Caregiver Appreciation Month. And because of COVID, we're going to extend it through March. So caregivers, hats off to you. This month is to celebrate all you do day in and day out to make sure your kids have great lives. And we really appreciate you. So I hope you get to join us.
Great. All right. Excellent. And great. Thanks,
you.
everybody. And that's Alice. That's cool. You were the first person to call the hotline that Lucy started. That's cool. All right. Thanks, everybody. Take care. Have a great week.
Great job.
God bless.
Thank you, Leo.
Oh, you're welcome.
Carrie,
Thank you.
can you send me the personal email?
Yeah. So, can you chat that in for me, please, Jarrett?
Huh?
Can you chat the address into me?
Yes.
I'm leaving it open for you, Jarrett. Chat it in so she'll have it.
Carrie,
All
I
right,
like your
take care.
picture.
Oh, thank you.
Beautiful.
Hey, Lucy, are you still at your same number?
Yeah,
I'm going to give you a call in a minute if that's okay.
sure.
Great. All right, everybody. Jared, hopefully you did. I got to end the meeting.
Yeah, I got it. Thank you.